Scanning the room.
Hello, my name is Sarah New and I am a nursing student at Williston State College. Today I'm going to be demonstrating how to administer a suppository as well as an enema, helping the patient onto a bedpan. In this case it'll be a fracture pan, as well as doing ostomy appliance care. So first things first, I received my orders from the doctor, so I need to compare these for any discrepancies. We do that to decrease medication errors. So first it's Shirley Coast is our patient, and that matches my MAR. Her birth date is 5/14/64, and that matches my MAR. Dr. Leo, same doctor on the MAR. Room numbers match. I see that she does have an allergy to codeine, so as I'm going through these medications, I will make sure and review if they contain any codeine. So first things first, he does have ordered Docosate sodium 10 milligram rectal suppository to be administered per rectal route for constipation, and that does match our MAR of sodium. Docosate sodium 10 milligrams rectal suppository to be administered per rectum, and this is going to be a one-time administration for constipation, and I know that that is what that is for, so that makes sense. If no results from the Docosate suppository within 12 hours, we need to administer a sodium phosphate 4.5 fluid ounce enema. We have that on our MAR, the sodium phosphate 4.5 fluid ounces enema, PRN, if no results within 12 hours from the Docosate. So, and all of that makes sense. I know that those are both for constipation. She's not on any restrictions as far as movement or anything. She's able to get up at lib. She's on a regular diet as tolerated. We're going to encourage fluids and record all INO. So, okay, so those are good to go. I'm familiar with these meds, so we can go ahead and get rid of our orders. And we have our MAR. We are in the medication room and supply room, so I'm going to go ahead and perform my hand hygiene. And first I'm going to go ahead and get all my supplies ready for the ostomy care. For that I'm going to need the paste and the powder. I'm going to need the adhesive removal. I'm going to need a 4x4 gauze. We need a bag clip and an ostomy bag. Okay, we need our template so we can measure her stoma. And as well as a face plate. This is what's going to stick to her belly and her stoma and the bag. Okay, so, and we're going to have to get her cleaned up when we do all that, so we're going to have a washcloth. This is my patient's bin, Shirley Coast. It's going to convert to her wash basin when we get to that step. Okay, so we got all that. All right, so we're going to go ahead and do our first medication safety check. We are going to need our Docosate sodium 10 milligrams rectal suppository to be administered one time for constipation. And we have our Dulcolax. This is 10 milligrams suppository, so that matches. Next, we need a sodium phosphate 4.5 fluid ounce enema as needed. And that will be if there are no results from the Dulcosate suppository within 12 hours. Okay, so I'm looking for that. We have our sodium phosphate, 4.5 milligrams, so that matches. Okay, so I'll just go ahead and get my med cup for that. And I know that I'm going to need lubrication for both of these, so those are my supplies. Okay, and we're also going to have to get her cleaned up, so we're going to have wet wipes and toilet paper tissue. All right, so that was our first med safety check. I'm going to go ahead and perform hand hygiene and go ahead and don some gloves. Excuse me. Normally you want to turn your back on your area. Okay, so to prepare the medication, like I said, this is our second medication safety check. So we need our Docosate sodium 10 milligram rectal suppository to be administered per rectum. This is one time for constipation. This is for Shirley Coast. So we have our 10 milligram Dulcolax suppository. Go ahead and remove that. We're going to put that in the med cup that is also labeled properly. Just double checking. Okay, at this time, I'm going to go ahead and add some lubrication. right into the medication cup, enough to lubricate the suppository and my index finger, so when I go to put it in place. Okay, so we need to go ahead and just do our second safety check for our sodium phosphate 4.5 fluid ounce enema as needed. And again, that's if no results are from the suppository within 12 hours. So that matches, that's good to go. All right, so all of this is gonna go to the patient's bedroom and where we will do our third medication safety check. We'll get all our supplies for our medication there. Okay. And for our ostomy care, we've already listed off our supplies, so we're just gonna keep that together while we go to the patient's room. All right, so off we go. I would have removed my gloves before I left the medication room. Knock, knock, knock. Hello, Miss Shirley. My name is Sarah. I'm gonna be your nurse today. How you feeling today? Yeah? Can you go ahead and give me your name and date of birth, please? Shirley Coast, 51464. All right, thank you. And do you have any allergies that you know of? You do not, or you do if you're allergic to codeine? Okay. Yep, we do have that documented. Let me just check your armband. Okay, thank you, ma'am. All right, so basically the doctor has ordered us to give you a suppository because you are constipated. So this is gonna help get things moving. All right, so the hands are clean. I'm gonna go ahead and do my third medication check for my Dulcolax. Okay, so that is the 10 milligrams rectal suppository to be given one time. Okay, looks good, everything matches there. All right, so I'm gonna go ahead and grab some gloves one more time. Let's get a couple pairs of these out. All right. How's your stomach feeling? Are you in some pain? Can you rate that pain for me? 0 to 10, 0 being no pain, 10 being the worst pain. Kind of at a 6. Okay, well, I'm gonna go ahead and listen to your stomach before we get started. All right, and I have cleaned to this with an alcohol swab. Okay, thank you. We have listened in all 4 quadrants, and it is kind of hypoactive in there, so let's try to get things moving for you. Okay, so have you ever had a suppository before? You have? Yep, it's a little uncomfortable, but it's a fairly quick procedure. So what I'm gonna have you do, we're gonna pull this down, and I'm gonna put a bath blanket on you. And that was also on our supply list, but those are usually located in the room, so we have that here. So what we're gonna do is you're going to take this arm, you're gonna reach over and just hold on to that bed rail. We're gonna flex this knee, you're gonna cross it over your other knee, and we're gonna roll over, okay? So on 3, 1, 2, 3. Good job. I'm just gonna pull your shoulder this way. We wanna have them from the left Sims position. Just keep them covered while we can. And you want to put a waterproof bag underneath their buttocks just to protect the bedding. Okay, and this position also is the most comfortable for the patient. It allows for the easiest access for the suppository, and it also helps it dissolve better and the medication just soak up better. So that's why we're doing this. All right, do you have any questions for me, Shirley? You do not? All right, so I'm gonna go ahead and get my suppository. I'll make sure it's lubed, as well as my index finger with my non-dominant hand. I'm going ahead and spread the buttocks, and I'm going to say on 3, I want you to take a deep breath and just blow out slowly. 1, 2, 3, breathe in, and I would push that in about 1 to 3 inches. And you want to make sure it's between the fecal matter and the mucosal wall. All right, Shirley, so I need you to hold that in for about 5 to 10 minutes, or just as long as you can, but you need to stay in this position for about 5 to 10 minutes. Okay, so I would go ahead and change my gloves. We're just gonna keep these on so we don't waste a bunch of gloves though. And okay, so those are going in the garbage. I would perform hand hygiene. All right. Just want to go ahead and get that cleaned up real quick. All right, so we have our wet wipe and our tissue. How you feeling, Shirley? That wasn't so bad, was it? All right, so we'll just wipe from front to back. We'll wipe from front to back. And we'll dispose of that in our biohazard bag. And we're gonna leave this here. All right, Shirley, so are you comfortable in this position? You are for now? Okay, so just like I said, you have your call light. If you feel like you need to go, even right now, I'll help you to the bathroom, okay? All right, so I have left the room. I'm gonna document that she received the medication. And it was about 9:05. Okay, and she tolerated it well, so we'll go ahead and document that as well. All right, so I would put the bed rail up, but as we know for recording purposes, this bed doesn't work so well, so we're just gonna leave it down for a minute. All right, so we would leave the room. 12 hours have passed and Shirley still has not had a bowel movement. So we are now going to give her an enema. So I'm gonna go back in the room. Hi Shirley, it's Sarah, your nurse again. So you still have not had a bowel movement. So the doctor has ordered us to give you an enema. First things first, can you please give me your name and date of birth? Shirley Coast, 51464. Thank you. And do you have any allergies that you know of? You do, you are allergic to codeine. Okay, I'm gonna roll you back over. I'm gonna go ahead and listen to your bowel sounds again, okay? All 4 quadrants. Okay, and she still is hypoactive, so nothing's moving along in there like it should be. Okay, have you ever received an enema before? You have not? Okay, do you have any history of glaucoma? Do you have any intracranial pressure? And I would have reviewed her medical record for that. What about like diverticulitis, any ulcerative colitis, nothing like that? Okay, so you can have this. All right, so at this time I have performed hand hygiene. We're gonna go ahead and do our 3rd medication safety check for our enema. And it is for the 4.5 fluid ounces, sodium phosphate, everything matches. So we're good to go for that. Okay, so we'll go ahead and remove that. Okay, we're gonna go ahead and need some lubrication. We have our wet wipes and our tissue paper, toilet paper. Okay. All right, so just like we did earlier, we're gonna roll you over on your side, okay? So I'm gonna go ahead and, I'm donning gloves, I have gloves on. Same thing, I want you to reach over and grab that side rail. And we're gonna flex this knee. And on 3, we're gonna roll. 1, 2, 3. Perfect, let me just pull your shoulder this way and you're gonna put this arm up, this leg straight. All right, so we have their bath, our bath blanket on. We're gonna cover the buttocks area. Okay. All right, so we have placed a clean pad under here. I still have my gloves on. Everything's good to go. We've checked your medical record. We're gonna go ahead and remove the cap for video purposes. I am leaving it on though so we don't get it all over the mannequin. So we will go ahead and lube that. Okay. Same as before, Shirley. On 3, I'm gonna have you take a deep breath and just blow it out slow. All right, so with my non-dominant hand, again, I do have clean gloves on. I'm gonna spread the buttocks, and then we're going to insert. 1, 2, 3, breathe in and blow it out. And you wanna insert it at a slight tilt and just go ahead and squeeze, and you would do a twisting motion to get all that medication in there. Okay, so that would be disposed in our biohazard bag. And again, we want our patient just to kind of hold that in for a good 5 to 10 minutes. Try to stay in this position, again, for about 5 to 10 minutes. Same reason as before, it just helps get the medication through the sigmoid and colon a lot easier. Oh, excuse me, I'm out of breath. Okay, so she tolerated that well. We need to go ahead and get the bedpan in place, and we actually would have had that all ready to go first. Okay, so off my gloves, hand hygiene. Shirley, you have your call light. I'm going to give you a minute. You just let me know when you're ready, okay? So I'm going to step away for a minute. She says she's ready, so I'm going to come back in the room, don clean gloves, and I'm going to assist her onto this bedpan so that she can go. Okay, so this is in place. All right, on 3, we're going to come over. 1, 2, 3. Very good. Okay, and again, this bed has issues, so normally we would want to raise the bed to about 80 to 90 degrees so that it was a more natural position for them to use the bathroom. I'm going to go ahead and doff my gloves, provide hand hygiene for myself. I would raise the bed rail and give them some privacy, make sure they have their call light for when they're finished. So I have provided privacy. She is ready. She buzzed me in and said that she's ready to get cleaned up. Okay, Shirley, how you feeling? Did you go? Oh, that's good. I hope you feel so much better. So again, just performing hand hygiene. I'm going to go ahead and don clean gloves. I would have her sitting back down out of the high Fowler's position. Okay. All right, same as before, Shirley. We're going to have you hold that bed rail, kind of flex your knee. And you're going to roll over, so I need to keep the bedpan steady as I help her roll. 1, 2, 3. Okay. Now I would take my wet wipe, get her cleaned up, toilet paper to dry. And just cover this. Okay. Set her back in place. All right, I would raise my bedroll. This time I would go to the bathroom and go ahead and dump this in the toilet paper hat so that I can record her in and out. So for now, we're going to set this aside. All right. You don't want to put the toilet paper in there because it could absorb some stuff. All right, so she tolerated that well. I am now going to document on my MAR that she tolerated that well. I need to always perform hand hygiene, always take your gloves off. Pretty sure I said that, so. All right, so that's up, call lights on. She's feeling much better. All right, so we're gonna leave the room. Oh, before we do that, we're gonna go ahead and take this bath blanket off and dispose of that in the laundry. All right, so that's in laundry. All right, Shirley. So I'll be back to check on you, okay? All right, so we have left the room. We're gonna go to the other side of the table now. Her bedroll is up, but let's go up. All right, so now we are going to be doing a ostomy, it's not on here, the ostomy appliance change. So I'm gonna enter the patient's room. Knock, knock, knock. Hello, Shirley. My name is Sarah. I'm going to be your nurse today. And I understand that you've had an ostomy for a couple of years now. So we're going to go ahead and get that appliance changed out for you today, okay? All right. So I will go ahead and perform hand hygiene. I'm going to listen to some bowel sounds before we get started. all 4 quadrants. All right, she's active, belly sounds good, there's no complications there. Okay. I'm gonna go ahead and grab my chucks from this side of the room. Okay, so we're gonna get these in place. You wanna put one over her lap. We're just gonna get her gown out of the way. Just gonna go ahead. Normally you just kind of put that arm out of the way, but this one's not gonna cooperate for us. Okay, so all that's good to go. I'm gonna go ahead and get my supplies out. Okay. So this is now my wash basin. I have dog clean gloves. We're gonna go ahead and remove this. Okay, so we need to remove the face plate. To do so, you wanna pull towards the stoma on all sides. All right, hold on. We're going to pause that 1 second because I need to have my bedpan within reach. Okay, so we have our bedpan. Again, we're going to pull in towards the stoma on all sides. I'm going to just put that right in there. We want to go ahead and cover with the 4x4 gauze. All right, at this time, I need to go ahead and wash around her stoma. Okay, so we're going to go ahead and doff our gloves, put on clean gloves. I'm over here, so I'm just going to go ahead and do it. All right, so we need to use our adhesive remover. Go ahead and get all of that sticky stuff off. Inspect the stoma for the color and everything. Make sure that looks good. I would dispose of this properly. Okay, so at this time I need to go ahead and use my template and measure. Yep, I think she's gonna do the 2-inch one. You want it to be about 1/8 of an inch wider than the actual stoma so it doesn't squeeze it. Then you take this. You do not drop your clip. We have our 2-inch, so we're gonna go right in the center. I'm gonna get my marker. Okay. We got our scissors. You just want to cut that face plate. And I already measured this at the 1/8 mark, so I don't need to go any further out than the stencil. Making sure there's no jagged edges. How you doing over there, Shirley? You having a good day? Oh, good. Okay, so it's a little jagged. I would go ahead and just get that edge off of there. All right, so this time I'm gonna go ahead, remove this. I would take my paste and put it right around the edge, and also put the powder. I'm just gonna put this right on that little pad, right around her stoma. Okay, so we're gonna press firmly. Fold the end. And clip it into place. Okay, you hear that snap. All right, so this is a transverse placement. So that means it's gonna come off to the side here, so it's kind of easier for us to change it. Okay, you want to just hear it kind of click into place. Make sure it's firm. You do not want these leaking. Okay, does that feel okay, Shirley? All right, so I would doff my gloves, perform hand hygiene. Also, before I did that, I would go ahead and get rid of all the stuff, dispose of it per hospital policy, most likely in a biohazard bag. Okay, so that's good to go. We will clean up our work area. I want to get this out of the way. I still have gloves on. All right, she's all cleaned up. This would go in our biohazard bag. Doff my gloves, just get her comfortable. All right, and she wants to take a little nap, so she's gonna stay laid down. Both bed rails are up. I'm gonna go ahead and document everything that I saw. The stoma looked good, color was good. I didn't see any indications of infection anywhere. All right, so it's about 9:05. Okay, so just clean up my work area. Shirley, you have your call light. You give me a call if you need anything, okay? All right, dear, I'll be back to check on you. That's it.